The Pearls of Wisdom from the Veterinary Behavior Symposium 2026. I'm Dr. Sally J. Foote, veterinarian and animal behaviorist with over 40 years of practice experience, here to help you, the pet owner as well as the veterinary team member, understand each other and the pet that you care for. So today's topic is the pearls from the Veterinary Behavior Symposium that was in Seattle, Washington in June of 2026. I attended the conference. I've attended it a lot in the past, and I don't know, since about a year or two before the pandemic, and then through these last 6 years, I haven't gone because I have been spending more time with a different veterinary behavior conference. But this one is held by the American College of Veterinary Behaviorists. So this particular conference always has the most current, and forward research in veterinary behavior medicine. And honestly, it's really where I had my kind of birth, if you will, my starting of getting more involved in animal behavior and also in speaking and writing. So a little bit about the conference, what makes it unique. So not only it's a specialty conference, it's a one-day single track of talks. And the talks are presented by a lot of the residents in the College of Behaviorists, and they're only 20 minutes long. So you get a lot of presentations. It's very fast moving, which I like, because I'm the type who, when you get into an hour-long, presentation with a lot of graphs and a lot of charts and a lot of statistical analysis of results, I get a little glassy-eyed, and I'm really listening for what's the kernel here, what's the pearl of the information I want to know. So I like this conference because they're direct and to the point types of presentations. So in this today's video, I'm going to go over what I feel are the most pertinent and applicable to general veterinary practice presentations from the conference that day. I do want to say another thing about going to a specialty conference. So I'm speaking right now out there to a lot of you general practice veterinarians as well as veterinary technicians, and anyone else that may have the opportunity, if you're in higher education, to go to a very focused, very niche type of conference. Don't be scared. In other words, you're coming in there with a degree that isn't maybe as high, or is as specialized or as advanced as a lot of the other people attending that conference. And it may feel a little intimidating, as if like, I don't really belong here. I know what that's like. I felt like that the first time I went. But the first time I went because I wanted to know and really learn more about behavior. I'd gone to some other, conferences like in tracks at general conferences. And there was an opportunity for me. I had submitted a topic because at that time, the Veterinary Society, which is for the general practitioners, was combined with the college. And so they had an open, call for papers on like, how do you treat? What do you do in practice that helps with behavior? So I had submitted and I was accepted then as a speaker to present my recording system for the medical record of the low stress exam. And I had never been before, but I was down there, went to Atlanta, and I remember walking into that huge hotel to find where the speaker committee was, because, they had to download the talks all on the main computer that would run the presentations, that day. And I just was walking down with that kind of pit in your feeling stomach of like, oh, I see ahead of me, all these well-known boarded behaviorists from the college. It presented at national conferences. And I sat down and I gave the committee member my flash drive where he was downloading the presentation. I had my fingers crossed there wasn't something that was going to glitch up, and have me look kind of stupid, right? And in that moment, Dr. John Sirabasi saw me, and he's a classmate of mine. He's also board certified by the college, and he saw me and he said, "Sally," and he came up and he gave me a big hug, and then he introduced me around to like Dr. Gary Landsberg and Deb Horowitz and others, and they welcomed me in. And they were so nice, and I had a great time, went out to dinner with them. The presentation went well. And from that experience, I really made a lot of good friends, and it launched me. It launched me on my speaking career, making this YouTube channel, which now I also have a podcast, and really getting focused in behavior and really leading with expanding knowledge on less stressful handling in veterinary exams. So long story about all that, but I just want to say that don't be scared. If you've got a special interest in something, go out there and go to that conference, learn, because everybody else who's there, even the highest credentialized people in the room, they started out just like you. Okay, so what are some of the pearls from the conference? All right. Well, first of all, the first one I would say is, it was kind of a theme, if you will. There were a couple presentations. I'm not giving you all the presentations, okay? I'm giving you what I think are some of the real highlights here. So as a theme, if you will, was having a second daily medication. A lot of times we give one medication like fluoxetine, okay, what's called an SSRI. And we've often been taught that to add a second medication, especially a tricyclic antidepressant like amitriptyline or clomipramine, will cause serotonin syndrome or cause harm. Well, the first presenter is a resident, and she presented a retrospective case studies looking back on quite a number of dogs with anxiety-related disorders that had initially, come to the behaviorist already on in one single medication and were still having, behavior problems. And so a second daily medication, actually it was amitriptyline, was added to that daily SSRI medication. And on average, these dogs were on the 2 medications every day for about 14 months. And they had at least, I believe, a 50% improvement of their behavior, and improving their behavior and resolving the behavior problems. There was not any evidence or any incident of serotonin syndrome or side effect. Both of these drugs were at moderate dosages, so they were not up at the highest, level dosages. And on average, at the veterinary specialty clinic where this resident is working, they saw these cases for about 20 months. So it's likely then it was a general practitioner that was carrying on and following up with these cases. So the pearl from this is, it's fine, and it is actually good to use 2 medications that are from 2 different drug classes to help increase the different neurotransmitters to help improve learning and help behavior, and not be afraid of causing serious side effects. Naturally, as like with starting any kind of medication, when you do a double, when you start 2 medications, you're always going to be looking out for side effects. It could happen with a single medication. But rather than constantly increasing the dose of a single medication, trying to have that one medication do all of the work that the brain needs, because there are at least 4 major neurotransmitters or brain chemicals that help to aid in reducing anxiety, aggression, and compulsion. Okay, serotonin is a major one. Norepinephrine is another one. Dopamine is a third agent, and acetylcholine is a fourth one. So different medications affect these different transmitters, and it's better to have 2 that are at a moderate or low level working together to help improve brain chemistry. So don't be scared, okay? Be willing to try it. Always know what the side effects could be. Stay in good communication with your clients, and clients communicate back to your veterinarian. Send them emails. Send them an email every once or twice a week to say, how is he eating? How is he acting? Are we seeing any increase in activity, etc.? So just keep us informed. Okay, now the second pearl was, it was a study done, and actually this was one of the first studies that actually proved, showed and documented how a feline dry cat food, prescription dry cat food, is designed to create a dilute urine, and also contains calming supplementation, so tryptophan and alpha-casazepine. Okay, that a diet would decrease inappropriate elimination, what's called periuria. urinating around outside of the litter box or excess urination. There was also significant improvement in the frequency of feline idiopathic cystitis. This is when the cats are straining, they have bloody urine, etc. None of the cats in the study had a blockage experience, yet these were cats that oftentimes relapse because of stress or other factors. So when the cats were fed this diet only, there was greater than a 90% decrease in a lot of the urinary symptoms, in relapse, and also urinating around the house. Over 50% of the cats who were given this diet and had never had it before with that calming supplementation in it showed improvement in their stress scores in the home. And we know that a lot of these cystitis problems in cats, especially when it is not due to a bacteria, is related to stress. The cat has other stressors going on in their home environment, and it takes a while to really get the home environment enriched, to add the other perches like to the windows, to get the scratching posts, to set up the food dishes around the house, to separate them all, and to try to figure out, do we have another cat in the house who's body blocking the litter box? Or do we have a new baby in the home and a 2-year-old in the home, and we need to have time to get these cubbies in places for the cat to get away from the children because the noise bothers them. That takes a while to get set up in the home. So by feeding this food, it does a lot of good to help prevent the relapses while then still enriching the home. And hearing this talk really brought me back to my roots of when I started in practice in the mid-1980s. When I started practice in the mid-1980s, it was just pounded in our head that if you have a cat who has come in, especially if they had previously blocked, meaning the obstruction, they cannot urinate because of the plug of crystals and debris in the urethra, and that's life-threatening, and you got them through that. But certainly if they had been straining, passing any blood in the urine, you feed them Hill's CD, cystitis diet, the prescription diet, and nothing else. No other food, because that food would help to create the dilute urine. It was also lower in certain minerals to help prevent the crystals from forming and help to manage and reduce the incidence of the symptoms. And we did not have a lot of other, say, medications for help managing the cats, etc. So it was just really, and even in the days of not having online pharmacy, say ordering for your food for home delivery and making it easy to get, the clinics I work for never ran out of CD. And if we had clients just regularly coming in, we thanked them. We really reinforced, good job, you're giving the CD, and made them know, let them know, like, hey, if you want to put a mark on the bag, when you get that low, so you get in here to buy the CD, we don't want you to run out. Because when they would run out, a lot of times the signs would return. Well, I've just kind of seen over the years, especially like in the last 5 or 10, a far less emphasis from many of the other veterinarians, and even at the college level, in the veterinary schools, they are not emphasizing the importance of diet. And this study is proving it. Diet matters. So if you've had a cat, or you have clients now who have cats with straining, difficulty urinating around the house, make sure they are on. In this study actually compared the Hill's diet as well as the Royal Canin urinary diet for cats that also contained the supplements for reducing stress. Both of those diets were used in the study, so they're both equally effective. Okay, third, that's good, right? So in this conference, like I said, multiple medications, that was kind of a theme. The other thing was, it was really nice. There was like this kind of integration of sort of human med and like people behavior with what affects with veterinary behavior. So this third study was looking at the variation of veterinarians and how they are assessing dogs in different kinds of health conditions, meaning conditions that may be painful. And why that was it because of breed? Or first of all, there was the assumption of there might be a breed bias here, meaning that oh, the golden retriever, that's very stoic. He's not really painful, even though he has a badly infected ear. Yet you have this Cocker Spaniel who's ducking his head and trying to bite you with an infected ear, right? So the same problem, but we're expecting like we're not thinking the golden retriever is so painful because his golden retriever, say, is more quiet, or we're just in goldens don't just bear pain better, right? Well, in this study, it showed that veterinarians will have a variation in how they judge a clinical condition, a health condition, with the exception of bone cancer, fracture. And so other conditions, though, they will not assess the pain the same. Some may say, yes, this animal is really painful and therefore needs meds. Some may say, no, he's not that painful. And really, it was the body language of the animal, what the body language that the animal is showing, the knowledge of the veterinarian and experience was the three factors that the veterinarians felt they relied upon for being able to judge how much, the pain level of this animal and therefore giving treatment. So a lot of our education level, maybe, you get the doctorate degree, right? That's pretty consistent. Now, what lectures I attend in continuing education, that'll vary. Some veterinarians may be very interested in pain management, and maybe they do more, say, orthopedic procedures, or they're working in emergency medicine where they see more trauma, so they really want to know about pain management. Other veterinarians may not be taking those CE courses so much because they have an interest or work in other areas. So a little bit about the education difference, I could see that, but the presenter really said that the biggest factor was reading the body language of the animal in pain to really interpret best what is their pain level. So it is going back to, really understanding body language and behavior. Because if an animal is very stoic and very quiet, not showing aggression, not showing avoidance to having parts of the body touched, which are the behavioral signs on the pain scoring charts, very similar to what our ladder of aggression, and behavior charts are like. If the veterinarian's not good at reading that or doesn't have those kind of handouts, and those graphics readily available to look at, kind of to compare, they may be missing, even though it's a quiet golden retriever. He may be doing mild avoidance. He may be doing mild flinching, and it's just doesn't mean he's less painful necessarily. He may just be showing it in a different way. So I think the more that we use like the Colorado Pain Score, which does have some of the graphic images of what the dogs look like when they're in pain, combined with reading the body language, the low levels of anxiety, because pain and anxiety run together, I think it will help even out how we all assess pain, and we're helping to treat and manage this for our patients. Number 4. A fourth pearl was clonidine is a commonly used medication now to really help decrease the reactive dogs, of bursting, of jumping and barking. And that can be used in combination with Prozac, fluoxetine, and SSRI. But the trouble is the clonidine really only lasts maybe 2 hours, 4 hours at best from when you give the dose. So it really needs to be dosed about 4 times a day, which doesn't work out with a lot of people's schedule or managing the dogs sometimes in shelters where there may be a lot of stimulus, where they're barking, and reacting a lot. So guanfacine is a different alpha-2 medication, but it lasts for 8 to 12 hours. So the presentation showed a group of dogs that were switched over from the clonidine to guanfacine, and that their behavior was still well managed, but it was actually better because there was more of a balance of the medication in their system. Now, some dogs, they didn't sleep well at night. Some may have been a little more agitated on the medication. So again, whenever there's medication, clients, be sure that you're emailing us, telling us, maybe even taking some video, and share the video by email that says, he's looking a little more agitated. This is what it looks like. And so it could be a matter we can alter the dose, or maybe that is not the medication, but for at least 35% of the dogs that were switched over, they improved on reducing their reactivity with this medication. I was really happy about this next presentation. And this was because anything that we can do, any medications and things that are safe for our kitty cats to help them be less stressed, especially during care, is just really important for their welfare. It's important for our clients that they're not so stressed out, seeing how much their cats are stressed out. And it helps us, the veterinary team, to be able to do a better examination, as well as less risk in getting bitten or scratched, being injured when we're giving care to pets. Okay, so for the cats, dexmedetomidine gel, Sileo is the brand name. It is approved for use in the dog, primarily for reducing thunderstorm fear. So it's a gel. It's like an oral gel, and it's just squirted between the cheek and the gum. And so this study looked at it was the first study ever done with cats, healthy cats. Okay, so these were not, and they were not aggressive, and they were not anxious or agitated cats. So this is the baseline of what is this we use it like we use it in the dog, in the cheek pouch. How long will it take to show effect? What are the effects? And are there any negative effects, say on blood pressure or heart rate, and how the heart is functioning? Because this drug class tends to slow the heart rate and may drop blood pressure. Okay, so giving this medication just right in the cheek pouch to a number of cats. They charted the cats at 15 minutes after dosing, 30 minutes, 60 minutes, and 90 minutes. So at 1 hour after dosing, that was when all of the cats in the study showed that they were the most calm, actually slightly sedate. It decreased a lot of the anxiety signs from handling that may happen. Drooling was common. Okay, so drooling was a pretty common side effect. It didn't cause any problems, but she'll let you know they're going to drool. And no change in their heart rate, no serious drop in any kind of blood pressure, and no abnormal heart rhythms. So this study was showing that the dexmedetomidine gel, Sileo, is safe to use in cats. And the amount that you would need to use to dose your cat, I think I put my syringe on, yep, here it is just going to, on average, would be about a 0.5 milliliter. So this is a syringe, I don't know if you can see it, that has about a 0.5 milliliter of fluid in it. So in order to give this, I'm going to go ahead and get my little friend here, Binx, over here, because he's right here. Come here, Binx. I know I'm going to wake you up. Oh, so let's see if Binx needed to get some medication, needed to get some of this at home. This could be dispensed to the client. And, so he hates getting a pill. And the gabapentin tastes nasty. This little syringe, what I would do is just always come from the side. Come from the side and just go right into your little cheek pouch there and squirt it down. You notice I'm not holding around the head. I'm not holding him tight. This just has water in it. But getting it down into, you could take the tip of it and just get right in the corner and then squirt down. It will get down. Now, if he swallows some of the gel, it usually, in the dog that is, if the Sileo is swallowed, you usually tend to see more sedation. I wasn't clear if there was any possibility of the cats having swallowed it, but by and large, the bottom line is it's a safe and effective product for us to use for our cats to help them to be less anxious, easier to handle for care and examination. So it can be given at home. Give it to your cat. Wait about 40 minutes before you put your cat in the carrier. Then head over to the veterinary clinic. So when you arrive, it's going to be at its peak effect. All right. Other topics. So again, kind of going back on the human side here, behavior side. There was a survey, more of like a survey done, looking at what pre-veterinary examination medication protocol, meaning giving a pill once a day, just 2 hours before the exam, giving the medication the night before, as well as right before the exam. Which way, and there were a couple different medications looked at that are given in this way. Which protocol or method is the method that most clients will actually do? It's really a challenge a lot of times in general practice that when we've sent home gabapentin, trazodone, maybe clonidine or other pre-medications to give before the veterinary exam so the pet is not as anxious, aggressive, struggling, sensitive to touch, that the client may walk in and go, I didn't give it. I just thought he did better last time. We'll be okay. And it's like, oh, brother. Or we wanted them to give it 2 hours before the exam and they gave it a half an hour before. It's like, well, no, it's not going to work so well. So it's a bit frustrating, okay, why there's this inconsistency with client compliance. So this was a first look at, all right, what protocol are they consistent with? The night when a client is advised to give a medication the night before the exam and then 2 hours before the exam, the majority of clients were actually following that protocol. Now, why that was, why do the people do that better than just 2 hours before the veterinary exam? That question wasn't really asked or analyzed. Now, that gets into a deeper study, which I hope will be done. Because I think the more we can understand about what helps people to do what we ask them to do, will help us then have ways for things to be effective and also to get feedback from clients. Now, one thing from this study that was a good piece of feedback was when a client saw that their pet was very sedate, and that usually happens at home after the veterinary exam, the medication's at its peak, there's no stimulus, so now the pet is sleeping or napping and looking sedated. The client didn't like it and they would not give the medication again. So communication, real important. Staff, if a pre-exam med was used and the client did do it, they gave both the trazodone and the gabapentin, or they gave the clonidine, etc. Next day or two, send an email, send a text, and ask, how was your pet after the exam at home? How did they eat well? Could they go outside to go to the bathroom? Did they exudate? What? Ask for client feedback. Now, clients, feedback, okay? Just send an email the next day, okay? Hi, just want to let you know my pet stumbled around in the living room for 2.5 hours, and it was really hard to get him to go outside safely down the steps. I'm worried about giving this medication again. Let us know, because we can adjust dosages. We may choose a different medication, or if we're going to go unmedicated, now we can tell you, the client, the homework we need you to do to prepare your pet. Come in and do the happy visits, practice handling the feet, get them happy about wearing a muzzle, things like this. But I think it was really helpful to see that the night before and the day of medication protocol was the one that was really best followed. So the day after it was a 2-day conference. The first day conference, again, it was a lot of these, residents and research really oriented talks. There was a whole poster presenters out in the lobby. That's always fun to go around and see just additional presentations up on a poster and the person who did it, being able to talk one-on-one with them. But the second day is the practice forum. So this is practical forum. So this is where now topics are presented that are to be very practically oriented, things that general practitioners can do or to address problems or issues that we see about behavior in veterinary medicine the general practitioner is going to have to, deal with. So one of the things, again, there was a whole roundtable talk in the first part with a couple of the behaviorists all talking about using the 2 medications at the same time, like multiple medication protocols, the safety of it, when do they choose to do it, how do you choose which drug that you do, and also, what's the scary part of it, what kind of side effects. So that was helpful. The best one, though, I really liked was there was an MD, a psychiatrist that is specialized in adolescent behavior, and she's integrative. So she did the presentation on the role of micronutrients in brain function and reducing anxiety in humans. And then Dr. Elise Christensen, who's the boarded veterinary behaviorist, immediately, followed up as, okay, now what do we know in veterinary medicine? How do we apply what's being learned on the human side to veterinary medicine from the role of micronutrients. So micronutrients are the vitamins like B vitamin, vitamin E, vitamin C, low levels of minerals such as iron, copper, and other selenium, zinc, these other nutrients, okay? And so the majority of food for humans, certainly, that we consume, and of course, animals are getting a lot of the same food source, is that two things. Our soil does not have as much of these micronutrients in it. There's been a lot of aggressive farming over the last, 100 years, and especially when a lot of fertilizer is being used, pesticides are being used, herbicides are being used, etc. That is also removing from the soil a lot of these micronutrients. So a lot of foods right now don't really carry as much of these nutrients in them that they did 50 years ago. So there's an effect on the body from that. Secondly, processing, the heavy processing of food. So while processing, especially in pet food, makes it easy, and plus pets have really benefited from a much more balanced diet that way, adding back some of the micronutrients makes up for that, and it really helps to improve the brain function. So the MD presented information where it was frankly as simple as a multivitamin, a balanced multivitamin. It's better to have, the pearl here is it's better to have a balanced vitamin supplement, and in this case she was saying like a 1-a-day vitamin, and when they are pet vitamins that have all the B vitamins in them, they have the iron in them, they have selenium, zinc, etc. that they need. Now remember, for pets you want to buy the products that have the NASC seal of approval on it. Okay, that's the third party tested to make sure it has in there what it has in there, and it's been screened for any kind of heavy metals or toxins to make sure that's not in the product. So a vitamin supplement for pets who have anxiety related problems is helpful in improving their behavior, and that's what Dr. Elise Christensen presented, was the role of especially B vitamin in brain function, and also probiotics. Because the healthy gut, the gut is where everything starts. The absorption of foods, especially these micronutrients, which then are going in the bloodstream, carried to the brain, and being processed for making healthier neurotransmitters as well as a healthier body. So I really appreciated that. That was fun. It was fun having an MD and a DVM presenting together. And they both said it was really kind of unique to do that, and they enjoyed it too. Okay, another pearl, CBD. Everybody asks about, uses, wants to know about CBD for anxiety and behavior problems. So the presenter gave a good presentation about how the cannabinoids do have pathways that they are working to increase serotonin in the brain. So there is proof that CBD can decrease anxiety and improve cognition. So Elevet is one of the companies that makes the CBD supplements that are third-party tested. They have done and approved by the FDA for specific treatment for arthritis. It's a higher, different dose for treating anxiety and cognitive problems. So he presented about that, and also emphasized himself the importance of using organic, whole hemp product for CBD, because the hemp plant absorbs from the soil a lot of any kind of residual fertilizer, any kind of residual pesticide, etc. So a field needs to be like very cleaned out, if you will, for years before you can grow hemp on it and have it really be the best and safe product. There's also a difference with using the whole hemp plant rather than only the extracted CBD. So a whole hemp product, Elevet makes one. There were 2 other boarded behaviorists also contributed the studies that they have worked on showing benefit of using CBD for reducing anxiety and also improving cognition in dogs. Okay, so the last presentation was a little bit heavy, but very important to have and very important to do. It's a topic I have published a course on this, and Dr. Sheila Robertson and Dr. Chris Pockel both Dr. Pockel is a boarded behaviorist. Dr. Robertson is a veterinary anesthesiologist. Both have independently presented on behavior euthanasia, a safe way to do a safe, compassionate behavior euthanasia. So at this conference, together they presented, it was a case. They presented this case of a dog that needed behavior euthanasia and how to do this in a way that would be safe as well as compassionate for the staff as well as the family and the pet in how do you do this. So they had a case where Dr. Pockel was a behaviorist, and after a period of time, the dog's behavior was not safe. It wasn't safe anymore. And so behavior euthanasia was the decision made. And so he talked about how the primary care veterinarian who was still caring for this dog, he knew, he contacted that veterinarian then could prescribe the pre-euthanasia medication to help the dog be calm and not scared or agitated. There's a home euthanasia service that could come to the home to do the euthanasia. That veterinarian was communicated with, and that veterinarian then did a walkthrough, a video walkthrough of the client's home so that veterinarian could plan out where we're going to do this in a way that's safe, that's filled with comfort and compassion for your pet and for the owner. The owners were given the instructions and they communicated well with on how to practice having the dog put the muzzle on and be happy wearing it, so that when the day came, the pet and the family's experience was one of kindness and calm and compassion and safety. And so the pet was able to pass away peacefully. Everybody knew what they were all to do, and every step of the way had just very clear consideration for that this being a very difficult and hard decision, but needed, and to have compassion for it. So following that talk, then Dr. Robertson and Dr. Pockel led the roundtable to discuss this, because it's not an easy topic to discuss, yet it is important, and we do discuss it. I do support behavior euthanasia, much like any kind of a medical problem, a physical disease that we cannot treat, and it is hurting the quality of life of the patient, it's hurting the quality of life of the people. Euthanasia is a choice, and there are behavior cases that are like that. So there was online attendance as well as people in the audience, and frankly, it went very well. People had questions about it, but it was very supportive and very helpful and very instructional. After the conference, I had a wonderful lunch with an old friend of mine and classmate, Pat Dorsey. The next day, we met up for lunch at a really nice Italian restaurant in downtown Seattle. And then I just walked down the street and got on the Empire Builder train from Amtrak and rode home. It was a really great weekend. It was a great conference. And, it blended, again, that time with learning as well as time for reconnecting with old friends, making new friends. And I hope any of you that have an opportunity to go to a conference, you take advantage of those times. Take some time to have fun and take some time to kind of explore a little bit. Well, thank you so much for being here. I hope this has been helpful and you enjoyed it. Please remember to like and subscribe. My little sign fell down here. Like and subscribe to the channel. Leave your comments below. I'll have some links below to some of the things that I've mentioned here and the website for the college if you wish to go there and see if you can get some of the online sources from the conference. I have my podcast available on my Substack account, and then I also do behavior consultations. You can contact me through my Substack account, which you'll see behavior consults on the tab. If you click that, it'll take you right to my website where I schedule that. I do dog and cat behavior consult by video call, and I collaborate with the primary care veterinarian. Thank you so much, and I'll see you soon.